Lactobacillus rhamnosus GG versus placebo for acute gastroenteritis in children. Acute gastroenteritis is a very common disease among infants and children worldwide. It causes significant mortality in developing countries and significant economic burden to developed countries. Viruses are responsible for approximately 70% of acute gastroenteritis episodes in children, and rotavirus is one of the best studied. Applications in medicine. Lactobacillus rhamnosus GG is the most clinically studied probiotic in the world, including extensive research in children. These studies have shown how beneficial probiotic supplementation with LGG can be to children in addressing such topics as diarrhea and other forms of gastrointestinal distress.
Probiotic bacteria are described at 3 levels: genus, species, and strain. In the case of the LGG strain, it is identified as Lactobacillus rhamnosus, LGG. Studies show that physiological benefits are strain-specific and only rarely apply to species, so it is important to choose a probiotic product containing a specific strain rather than only a species.
We are proud to say that the LGG strain is the most researched probiotic strain in the world today, with more than 1,000 publications listed on PubMed. This is by far the largest number of publications for any probiotic on the market today.
The LGG strain is used worldwide for food and supplements, for instance in capsules, stick packs and yogurt. Also, as early as 2007, the LGG strain was notified as generally recognized as safe by the FDA, and Lactobacillus rhamnosus was granted a qualified presumption of safety by EFSA. In addition, the LGG strain is included in the WGO guidelines for probiotics and prebiotics.
The LGG strain is an excellent probiotic. It may help restore and maintain the natural balance of the good bacteria in the gut. Factors like diet, stress, and antibiotics may disrupt the delicate balance of our gut microbiota. And clinical studies have shown that the LGG strain can be helpful against an upset stomach, as experienced, for example, by children and travelers. And it may also have a beneficial effect against the digestive discomfort that is often associated with antibiotic use.
At Christian Hansen, we are constantly doing research to better understand the mechanisms of action that enables the LGG strain to deliver its health benefits.
One of the main properties of the LGG strain is its ability to persist and adhere in the gastrointestinal tract. Its ability to adhere is mediated through the appendages called the pili.
These pili have been demonstrated to have powerful adhesion properties towards mucus and the epithelial cells, and play a key role in the LGG strain's ability to persist in the intestinal mucosa.
Another characteristic of LGG is its ability to protect epithelial cells from injury and even enhance mucosal regeneration. It achieves this by stimulating the epithelial cellular responses, including the recovery of the epithelial barrier layer, the production of cellular protective proteins, and the blockage of the cytokine-induced epithelial programmed cell death.
It may reduce the duration of acute diarrhea in children and help reduce the frequency and severity of abdominal pain. Although in a study where LGG was given to preschool children with acute gastroenteritis, those who received a 5-day course of LGG did not have better outcomes than those who received placebo.
Every year, gastroenteritis accounts for 1.7 million visits to emergency departments by children in the United States. Probiotics represent an expanding industry with potential clinical benefits, but there are limited data supporting their use in this population. This multi-center randomized double-blind trial included 886 children between 3 and 48 months old who presented to the emergency department with acute intestinal infection, clinically diagnosed on the basis of 3 or more episodes of watery stools in a 24-hour period, and vomiting or diarrhea for less than 72 hours. The children were randomized to take by mouth 1 sachet of probiotic preparation containing Lactobacillus rhamnosus and Lactobacillus helveticus, or placebo, twice daily for 5 days. The primary outcome was the occurrence of moderate to severe disease as defined by a modified Vesicari scale score of 9 or higher within 14 days. The proportion of children with moderate to severe disease was similar between groups. After adjustment for trial site, age, and pre-enrollment frequency of vomiting and diarrhea, the treatment assignment did not predict moderate to severe disease. The authors conclude that in children presenting to the emergency department with gastroenteritis, twice-daily administration of a Lactobacillus rhamnosus, Lactobacillus helveticus probiotic combination did not prevent the development of moderate to severe disease within 14 days. Full trial results are available at nejm.org.
There are no scientific studies or reports that show the usage of this probiotic as a treatment of acute gastroenteritis in children in Ecuador. Anyhow, there are a few articles that talk about the benefits of consuming probiotics. To conclude, it has been proved that LGG doesn't make a significant improvement in acute gastroenteritis.
This is the Emergency Medical Minute.
Okay, this will be quick. Probiotics for acute gastroenteritis. Concept really compelling. Under duress from illness or medications, the GI biome is altered, so we use probiotics to come to the rescue and kind of restore the natural balance. How does it work in real life? So a study, pretty well done study out of Canada for acute gastroenteritis in pediatrics showed really zero benefit for probiotics. So what they did is it was a randomized double-blind controlled trial, 886 pediatric patients in 6 Canadian emergency departments with acute gastroenteritis, acute diarrheal illness, less than 72 hours of duration. They randomized them to 5 days of probiotics or 5 days of placebo. In the end, 25% of each group went on to develop moderate to severe gastroenteritis, and the duration of symptoms in each group was exactly the same. So for acute pediatric gastroenteritis, no benefit. It doesn't mean that there's no benefit for anything else, but specifically in a pretty well done trial with good numbers, looks like it probably doesn't hurt, but most likely it doesn't help.